are you doing? I hope that you're well. I hope that you've had an amazing week so far. It's on Wednesday. Tulembua wiki one's on Sunday. So I hope that you had an amazing Sunday. You had an amazing Monday and Tuesday. And now we are here, and also pray and hope that you had an amazing night. And you're here for the Afya Clinic. Of course, unajua hapa ndani ya Afya Clinic is where we get to talk about everything health. And today we are having a very interesting conversation. And this is something enye ninajua ina affect most of the people. And not once, not twice. Umekuwa kituliza, no, you want us to talk about this particular topic. I'll be introducing it in a very, very short while. Okay, karibuni sana. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God, and my name is Kahugo. Today we'll be here up to 10 in the AM, and we'll be introducing something else a bit later. We felt it's very important for us to talk about maximizing the potential of kids wakiwa nyumbani. So we'll be talking about that a bit later, of course, after tumemaliza mambo ya Afya Clinic. But for now, tutakuwa tukianza na the health updates, because we need you to understand what's happening in the health sector. Okay, and if you have anything else and you umesikia mahali and probably you want us to clarify on that, you can text us as well and we'll be able to answer it. Before we get into the health updates, just to remind you, I know that you know our numbers, but just to remind you is that our numbers zinabaki kukua zile 0721 105 105 on WhatsApp 23814, our SMS code, which is absolutely free. But of course, we are live on Facebook on MBCI TV, Facebook page. We're live on YouTube on MBCI TV official YouTube page. But of course, you can always find me as well on all social media platforms as Rachel Kahugo. Okay, so that's it and done. Let's get into the health updates today, where we look at okay, so the first news item today is that the Prime Cabinet Secretary launches the National Opacas Guidelines to enhance maternal health. Honorable Musalia Mudavadi and the Cabinet Secretary of Health, Dr. Deborah Barasa, launched the Uhai wa Mama na Mtoto UMM project and the National Obstetrics Point of Care UMM project and the National, so the Opacas project. And the guidelines were launched on Monday in Nairobi. This initiative marks a significant commitment to reducing maternal mortality and improving healthcare access across the nation. During her address, Dr. Barasa highlighted the pressing challenges in maternal health, in particular the limited access to ultrasound services attributed to equipment shortages, inadequate training, and prohibitive cost. She asserted that the newly introduced OPACAS guidelines are timely solutions that will facilitate early intervention and prompt referrals, both vital for improving outcomes for mothers and their newborns. The OPACAS guidelines align with the national health policies and aim to standardize ultrasound services across various healthcare levels, focusing on underserved regions. They provide a comprehensive framework for policymakers, healthcare workers, and training institutions, ensuring consistent and effective care delivery. The Ministry of Health encourages healthcare providers to implement these guidelines, reinforcing the country's healthcare systems and fostering a healthier future for mothers and babies. I know that we've really talked about mothers and babies, especially with Dr. Jemima Karaoke. And now for all the mothers, if you're expectant, if you're looking forward to getting a baby, now you know what exactly you need to do. And as we can see, the Cabinet Secretary of Health, Dr. Barasa, is also looking into it. Now, we'll be getting into the In History segment. That is it, what's happening on the health sector. So we're getting into the health updates. Note the health updates, the In History segment, where we get to tell you about peptic ulcers, because today we are talking about peptic ulcers. And we've had very many people complaining about heartburns, complaining about ulcers, and we'd want to know what exactly causes ulcers and what is ulcers. So for any question that you have regarding the same, we'll be having Daktari together with us in a very short while, and he'll be able to answer all your questions. So on all our media platforms, as I had told you before, on WhatsApp, our short code, the SMS number, or on all social media platforms, we'll be able to get your messages. All right, but for now, let's get the In History segment so that you'll be able to just understand what exactly is peptic ulcers.
The Greeks, including Hippocrates, described ailments resembling ulcers, attributing these painful conditions to imbalances in the body's humors or digestive liquids. Treatments varied from herbal remedies to dietary adjustments, but the true cause remained unknown. It wasn't until the 19th century, with advancements in medical science, that researchers started to make significant progress. Dr. William Beaumont, an American physician, conducted some of the first studies on stomach function and acid secretion, paving the way of understanding the stomach's acidic environment as a factor in ulcer formation. By the early 20th century, the quote-unquote acid theory of peptic ulcers emerged, emphasizing stomach acid as the main culprit. Doctors believed that ulcers developed from an excess of stomach acid, often triggered by stress, poor diet, and lifestyle factors. This view dominated medical thought for much of the century, leading to treatments that focused on acid suppression through antacids, diet restrictions, and tranquilizers. However, ulcer recurrence was common, suggesting that acid control alone might not address the root cause. The stress theory also persisted, connecting high-stress lifestyle with ulcer development, an association that influenced both public opinion and medical treatment approaches. A major turning point occurred in the 1980s when Dr. Barry Marshall and Dr. Robin Warren discovered Helicobacter pylori, H. pylori, a bacterium present in many ulcer patients' stomach linings. Their groundbreaking research revealed that H. pylori infections, rather than lifestyle or acid alone, was the primary cause of most peptic ulcers. This shifted the medical approach entirely, allowing physicians to treat ulcers effectively with antibiotics alongside acid-suppressing medications. Their work, awarded the Nobel Prize in 2005, revolutionized the understanding and treatment of ulcers, providing a lasting cure for millions worldwide and marking one of the most significant discoveries in gastrointestinal medicine.
And we are back after that short segment. Now you've been able to understand the history of peptic ulcers. And now we're here to answer all your questions. And we're here with Dr. Winston Makanga. I'm very sure he's not very extremely new to you. He's been here before, but a bit many years ago. So we'll be talking about that, but I'd want you to know who exactly Daktari is. So as we get into the discussion, you'll also be able to ask your questions. So let's get to know who Dr. Winston Makanga is.
Dr. Makanga is a laparoscopic and endoscopic surgeon based in Nakuru. He's a lecturer at the Department of Surgery at Egerton University. He also consults for St. Joseph Mission Hospital, Gilgil, and the major hospitals in Nakuru. He graduated with an MBCHB degree at the University of Nairobi in 2005 and a postgraduate MMED degree in general surgery from the Aga Khan University in 2012. He recently graduated as a fellow of the American College of Surgeons, and his interests are in the field of gastrointestinal endoscopy, minimal access surgery, foregut surgery, and bariatric surgery. He is dedicated to medical education, and he inspires to avail minimal access surgery to the semi-urban and urban areas at an affordable cost.
All right, so that is who Dr. Winston Makanga is, and I know that now you've been able to know him. Now we're getting into this discussion, and today we are talking about peptic ulcers. Now, peptic ulcers is a disease that many people complain about. Actually, we have a very high percentage, and Doc will be telling us about it, of people who complain about heartburns, and especially heartburns. It happens a lot. And we'd also love to know, is it heartburns and the peptic ulcers, are they the same thing? Now, karibu sana. How are you?
Fine, fine. Thank you, Rachel.
How have you been?
Very nice.
Long time?
It's really nice to be here.
Thank you.
Yeah, I think it's almost like my second home now.
Yeah.
First time I came, I was very anxious, but today, very, very relaxed.
Okay.
Yeah. So,
today we're talking about peptic
ulcers. And I like how you started. There's heartburn, there's peptic ulcer, there's acidity. There's a lot of words we throw around. And it's good to understand that this thing we call acid or ulcer is not one disease.
Yeah.
It's a group of almost 10 diseases, which I won't even list. I'll list the commonest, which is around 4 or 5, which are commonly known. Starting from simple reflux, which is what you're calling heartburn, where you feel a lot of burning sensation in your chest. Then you have what we call gastritis. Gastritis is also a form of acid problem, but it's just a mild form of ulcers, where you have a lot of acid in the stomach, but not enough to cause ulcers. Then now you have the peptic ulcer proper, which means they are actual ulcers. And this can also be divided into two. You can have either ulcers in the stomach or in the first part of the small intestines. So if you have ulcers in the stomach, we call that gastric ulcers. If you have ulcers in the small intestines, we call that duodenal ulcers. So you can see it's a big group of diseases. Yeah. So when you just tell someone you have ulcers, the doctor still has to interrogate further to know what specific type. Because, for example, some of them are treated simple by basic antacids. Some of them require antibiotics. Some of them may even require surgery. So depending on which one it is, we have to be sure what we are treating.
Now we'll be getting into the depth of it because we've also heard of the kits. Some people go to hospital and they're given the kit. Is that the antibiotics?
Yes, the kit is composed of 2 antibiotics and 1 drug to suppress the acid.
Okay. Now we've also heard of this term H. pylori. Is that the ulcer that you've talked about?
Okay. We're going to get to that when we're discussing the causes. But when people talk about H. pylori is now coming out as the major cause of ulcer problems.
Okay.
Yeah. Before, we used to have ulcers mainly because of medicines we take, especially painkillers. But now we are seeing more and more ulcers being caused by this thing called H. pylori. It's actually a bacteria. It's a germ which you eat. Basically, by eating food that is not well prepared or a salad that has not been washed properly, we actually ingest the bacteria.
Okay.
So when the bacteria gets in your stomach, I'm hoping at some point during the conversation we'll have time to discuss how it actually causes the ulcers. But once it gets into your stomach, it has certain abilities that make it able to dig through the wall of your stomach and cause ulcers.
Okay, let's even talk about the causes now, because a lot of people are really complaining about that, especially the burning sensation. It's usually very uncomfortable, and then we get a lot of questions on that. So you said it's caused by the H. pylori.
H. pylori is the main one. Actually, if you randomly select people who have ulcers, more than 2/3 of them will have H. pylori.
H. pylori, okay.
H. pylori is an African disease. Yeah, simply because of our hygiene practices, our food preparation practices. H. pylori is right on top. And we tend to get it very early in life. But it has a course it takes before it establishes itself to cause ulcers.
Okay.
It's not a bacteria you get today and you have ulcers tomorrow. Yeah, there are years that pass until it's now able to nicely live in your stomach and now start causing ulcers.
Okay, so what's that process like?
It's just like an infection elsewhere. If you ever have a bacteria infection anywhere, you first get a few bacteria getting into your body, then they start multiplying. After they multiply to a certain number, they start now releasing the so-called toxic substances that now start causing effect in your body.
Okay.
So for H. pylori, that process of getting into your stomach, multiplying, to start now releasing toxins that cause ulcers takes a while.
A long time.
Yeah, not like pneumonia. Pneumonia will take 3-4 days to develop. Now, H. pylori takes a while. Okay. Because also remember, the stomach is not a place where bacteria survive easily. Yeah, the stomach has a lot of acid naturally. You know, for you to eat and digest your food, you must release acid. Now, that acid is God's way of making sure bacteria do not pass into your intestines. So now H. pylori has specific abilities that make it fight the acid. Yeah, it has a way it can coat itself to shield itself. It has certain toxins it uses to neutralize the acid on its surface so that it's able to survive the environment of the stomach. So you can see all this process will take a while before it grows enough to start causing ulcers. Then the second major cause of ulcers is painkillers. Yeah, and here painkillers, we are very specific on which painkillers we're talking about. Yeah? A lot of time you get these back pains, joint pains, you rush to the shop and buy Maramoja or Brufen or diclofenac. Now this group of medicines are called NSAIDs. NSAIDs is NSAID. It's a short form for non-steroidal anti-inflammatory drugs. What these medicines do, when they get into your body, they go into the stomach and then they disable one very important function of the stomach. In your stomach, one of the ways in which you protect yourself from ulcers, you have a very thick layer of mucus that is on the surface of the stomach. So this layer of mucus prevents the normal acid from burning your wall. Now what the NSAID drugs do, they mess up with the mechanism that synthesizes the mucus. So the more you take those medicines, the mucus layer becomes thinner and thinner. So then the acid is able to get to the wall of the stomach.
Right.
And because we actually consider use of these painkillers as an epidemic, people are using without prescription. They go in without understanding the implication and just buy. So, and some of these diseases, we take these medicines for our long-term diseases. For example, arthritis or back pain. Right now, if you random shows in the village, 90% of them have some form of back pain or joint pain. So they're always on medicines. And the longer you take these medicines, the higher the risk of having ulcers. So other than those two, there are many others. You'll hear people talking about alcohol, people talking about spices, people talking about stress. These are generally not direct causative factors, but they're contributory. So first you must have one of these two, either H. pylori or NSAIDs. Then these ones, they augment. But primarily, they may not cause ulcers directly. They usually find a situation where there's a problem first, then now they just encourage the problem to get worse. There are rarer causes of ulcers. Like one I need to mention is something called ZES. It's a rare disease where someone is born, naturally they produce too much acid. It's a very rare condition, so we usually don't discuss it much, but it's just good to mention it.
Okay. Now let's talk about the NSAIDs kidogo. As you said, many people use painkillers for different reasons. Now, do we have painkillers that don't really... Okay.
Very nice question.
Because
so,
I'm assuming someone who's having a back pain, they'd want to take a painkiller.
Good question. I mean, what is the purpose of a doctor? The doctor must relieve pain or suffering generally. So we can't say that now you can't take pain. Now, remember it said the group of painkillers that cause ulcers are NSAIDs. So not all painkillers are NSAIDs. We have a million other painkillers that are not NSAIDs. But unluckily for us, the options are narrow. NSAIDs are one of the most effective painkillers. So that's why we have a problem. The most effective painkillers also cause ulcers. So we have Panadol. Panadol is actually not an NSAID. This simple Panadol, it's a very effective painkiller, and it works, and it does not cause ulcers. You might have heard of something called Tramadol. Tramadol is also a painkiller. It's not an NSAID. And now with the advances in technology, we are starting to create, or rather to manufacture NSAIDs that may not cause acid as much as possible. For example, you'll hear of drugs like celecoxib, etorecoxib. They are NSAIDs, but from studies they're saying that they do not stimulate as much acid as possible. So people who have diseases like arthritis, arthritis, in as much as you try to avoid NSAIDs, you have to use NSAIDs. You get? Like you'll try your Tramadol, your Panadol, but the inflammation on the knees and the back must require some element of NSAID. So we'll prescribe this either for a short time. Remember I told you that NSAIDs, one of the ways they cause acid is by using them for a long time. So if you can use the options I've given you that are NSAIDs, but they produce less acid, but for a short time. Say 5 days and you stop. Then you continue with the Panadol. That's the only way you can try and avoid. But generally, especially for a patient who has established ulcers, even those NSAIDs I've said, we totally tell them not to use.
Now you've had people saying that these ulcers can also be hereditary. So from the causes that you've told us, does it now demystify the fact that it can't be hereditary?
Clearly, from the causes I've said, it's unlikely. It's unlikely because you don't inherit use of medicines. That is something you use. You don't inherit use of infection by H. pylori. You don't inherit that. What we see is something called familial. Now, when I was a student in the university, I had a difficulty understanding the difference between hereditary and familial. Hereditary just means you'd get it from the genes. Meaning if your dad had defective genes, you get them. But familial means it occurs in the family, but not necessarily because of genes. For example, in the same family, you tend to eat the same food, isn't it? So if all of us eat the same food, we tend to get the same diseases. But not because I've inherited it, just because of being in a family. So we all eat the same ugali, the same skuma, the same spices. So I'd like to think of it more in terms of familial. That it tend to cluster around family, but not genetically. The only one way I can explain genetics here is the condition I told you, the ZES, where you actually inherit a defective gene for producing too much acid. But it's a very rare cause of ulcers. Then secondly, you remember I talked about augmenting factors like stress, tendency to anxious status. Those are things which they may have a hereditary component to them, but you can see these are not direct causes of ulcers.
Yeah.
So strictly speaking, they're not hereditary.
Okay.
In its direct sense.
All right. Now, about the being hereditary, now we've cleared that. I know that we'll be getting on with busters from the people, what people think about peptic ulcers, and you truly know their myths. Or zingine, utatuambia ukweli, they're true, they're not myths. So we'll be looking into that in a very short while. But I've also had people saying, especially the people when you're gonna heartburn, you said reflux. Yeah, chatwite, reflux.
Okay, reflux.
Yeah, for the people when you're gonna reflux, they say there are foods they can't eat. Things like viazi, things like scuba wiki. So what's the relation there?
Okay. Again, reflux and peptic ulcers, again, not exactly the same disease, slightly different, but I'll try and address both to cover the issues.
Okay.
Now, once you have these two issues I said, and remember I talked about things that worsen an already bad situation. So let's say you're already predisposed to getting ulcers, there are certain things that will worsen the problem. Yeah.
Okay.
And there are a group of foods. Yeah, these foods tend to do two things. Either one, they tend to encourage excessive production of acid, or two, the drug, the food itself has a direct effect on the stomach. For example, spices, like a very harsh pili-pili, very concentrated coffee, alcohol, sukuma. Some of them, they can directly affect the wall of the stomach. If you have ever tasted pili-pili, it burns you on your tongue, isn't it? So the same process that happens on your tongue also happens in your stomach. It's basically a burning chemical. Okay. So once it touches on the skin of the stomach, it affects. So these foods we usually tell people to not take. They do one of the two things. An example I'll take is sukuma, or even beans. Once you eat these beans, they tend to encourage the stomach to produce too much acid. In fact, you'll have noticed, even for people who don't have ulcers, if you ever woken in the morning and taken coffee, you usually will feel some form of some heartburn kind of thing, or beans, same thing. In fact, beans, what it does, it causes a lot of flatulence. It causes a lot of gas in your stomach. So there are foods which do that. They either increase the level of acid production, or they are directly responsible to burning the wall of the stomach.
Okay. Now, what are the, I know we'll be getting to now really understanding what is this heartburn, because I've seen someone asking, but what are the symptoms of peptic ulcers? Because you've said they're different. So how would I know I have peptic ulcers? Must I wait mpaka nianze kufeel uchungu kwa tumbo?
So first, the general symptoms for all this, all of them have typical general symptoms. Then there are a few symptoms that tend to define one from another. So in general, people with peptic, let me just lump it together like peptic. In fact, these days we call it peptic ulcer syndrome, or PUD syndrome, peptic ulcer disease syndrome. They generally share certain symptoms. Some of the commonest symptoms they share are, one, epigastric pain, pain at the top of the stomach here, the upper part of the stomach. You have a lot of pain, especially after food. They are typically related to food. So that relationship must be there. If it's pain that is not connected to food, it may not be ulcer disease. That's one. Then number two, you have this feeling of nausea, like you feel like you want to vomit, or sometimes you actually vomit. The other thing is you feel bloating. Like bloating means you feel like there's a lot of gas in your stomach. Like you eat and you feel full in your stomach. Now that is in general. Then there are certain specific things. For example, if you have reflux, you will tend to have what is called heartburn. Heartburn basically is pain behind the breastbone. There's a bone in the center of the chest. So sometimes you eat and then you feel a lot of acidity behind that bone. And sometimes you even feel sort of like food or bile coming up into your throat. And then you have to forcefully swallow it. And then for some people, when they lie down at night, when they eat, they feel the food coming up. Or sometimes when they bend forward to pick something, they feel the acid coming up. That's regurgitation. It's part of reflux. Some of them, it will become severe to the point where now they even start feeling throat pain, because now the acid goes all the way up to the throat. They start coughing, they start having to clear their throat all the time. Some even feel like there's something stuck in their throat. All those are signs of reflux. Now when you come to gastric ulcer or ulcer in the stomach, it's typically pain immediately after meals. They eat a meal and immediately they feel very severe pain at the upper part of the stomach. It's not a very direct a way to know, because many other things can do that,
Okay.
but it's roughly, if you have those kind of symptoms and upper pain, especially after meals, that is it. Then for peptic ulcers in the duodenum, they are slightly different. Now these ones, immediately after the meal, you may not feel pain. But when you go to sleep, at around 1 to 2 a.m. in the morning, you get woken up by a very sharp pain right up here,
Okay.
in the upper part of the stomach. It's very typical for ulcers in the duodenum. Remember I said ulcers can be in the stomach or in the duodenum. So the ones in the stomach, they tend to be immediately after eating.
meals.
But in the duodenum, they tend to not present very severely immediately after you eat. But at 2 a.m., in fact, we typically say 2 a.m., it wakes you up.
Why exactly after that period of time?
It's because now the food has left the stomach and has gone to the intestines, and now the excessive acid being produced has nothing to shield the intestines. Yeah. So when it goes into the duodenum, it finds a bare area and it starts burning directly where the ulcer is. Remember, an ulcer is basically a wound in the lining of the intestines.
stomach.
Yeah. So you can imagine it's a wound and you're pouring spirit on it. That's almost how you can think about it.
Okay. Okay. Now, let's now go back. Now that you've explained how you know you have the reflux, so let's talk about what exactly is reflux and how different is it from the actual peptic ulcers? What causes? Is it different? Ukiwa na heartburn, does it mean that probably sometime you'll get peptic ulcers? Is it a predisposing factor?
As I said before, this peptic ulcer syndrome, they tend to affect the same people, isn't it? So people who are predisposed to ulcers also are the same people who might have reflux. But they're not the same disease. Reflux basically means, it's actually an English word, reflux. It just means stuff in the stomach is coming back up into the food pipe.
Okay.
Remember, God created us in a very interesting way. When the food passes from the food pipe into the stomach, it doesn't come back. In fact, if you ever eat a meal and then I hold you upside down,
Yeah.
food doesn't pour out. Yeah. Why does that happen? It's because there's a valve. There's a valve between the food pipe and the stomach. So people who have reflux tend to have a problem with that valve. That valve loosens, so it widens.
Okay.
So by widening, it means every time they eat, yeah, the valve is not able to hold acid. And remember, the food pipe is not a place that is used to getting acid. The food pipe is a place that is free of acid because of the valve.
Yeah.
Now, when you have it opening up, it means every time acid comes up, it burns the food pipe. That's why you get those symptoms: the heartburn, the belching, the throat pain. This is because now acid is leaving its normal place. Acid, when it stays in the stomach, in its normal quantity is not a problem.
Yeah.
But when it starts going to places that it's not supposed to be, it causes burns.
Okay.
Yeah, that is reflux. But ulcers, peptic ulcers, just means a wound in the stomach or in the duodenum.
All right.
They may occur in the same patient or they may occur separately.
Okay.
Yeah.
Oh, perfect. Now, let's get to take a look at some of the myth busters so that we get to see what are some of the myths that are related to peptic ulcers and also to the reflux. Now you've had it's different because most of the people would think it's the same. You'd hear someone when you're na reflux akisema we niko na ulcers zinanisumbua, but now you've known it's different unless you have the same, because you said it would occur in the same patient.
It can occur.
Yeah, so that it would happen that you're having reflux and you're having the peptic ulcers as well. But for now, let's get the myth busters. So the first one says, and I think you've addressed it already, that stress is the main cause of ulcers.
No, it's not.
Yeah.
It's just a contributory factor.
Okay, so you've mentioned too. You say that the first main cause would be H. pylori.
H. pylori,
and the other is?
The medicine, the painkillers.
The medicines, painkillers. Okay. The second one says that over-the-counter antacids can cure ulcers.
If it is ulcers that are caused by H. pylori, that may not be enough. That is why when you have ulcers, we have to run some tests. One, you have to run a stool test to see if your ulcers are being caused by H. pylori.
Okay.
So there's a stool test, I'm sure many of us are aware of it, where they test the presence of H. pylori in your stomach. If the H. pylori is there, then over-the-counter medicines will not be enough.
Okay.
Yeah, you have to take the antacids plus a medicine that will kill the bacteria.
Okay.
Because if you just take the antacid and the bacteria is still alive, it will just come back.
Okay.
If it is the one caused by NSAIDs, just stoppage of the medicine and maybe a short course of antacids, that should cure it. But again, when you say antacid, what are we referring to? Is it the syrup? No, the syrup is not enough. The syrup basically just lines the stomach with some coating, but the actual antacids that work are called PPIs. Yeah? These are what you may have come across: esomeprazole, omeprazole. They are in the shops. These ones are taken over a period of around 2 weeks. They actually can cure the ulcers.
Okay. Now this is very interesting, something I didn't know about the syrup antacids, because many people use the syrup antacids. So you say that enough won't help?
No, they work very differently. The syrups, when you swallow them, they just form a coating. You remember I talked about a mucus coating? They basically do the same. They just enhance the coating. But they do not target what was causing the ulcers. What the omeprazoles and the esomeprazoles do, they go and directly stop acid production, excessive acid production. They work on a certain mechanism where the acid is produced and stop it. Remember, when you're getting ulcers, it means the acid is too much and it's causing the wounds to form. So if you can reduce or stop them, then that's how. In fact, most of the time we use them in combination. So you find that we use the antacid syrup for quick relief of the acidity and the heartburn, but we also have to add the omeprazole to now reduce the acid and enhance the ulcer healing.
Okay, that's very interesting. The third one on what you're having to do in the milk pastas is that milk can heal ulcers. Now, this is very common to many people who have ulcers.
It will not heal, it will just reduce the symptom. Yeah, it will. Milk in itself is an alkaline, so it will ease the symptom. In fact, most patients will have figured it out by themselves. They'll tell you that when they take milk, in fact, it's one of the ways we know that this person has ulcers. They'll tell you when I take milk, it reduces symptoms. But let me throw a spanner in the works. Now, if you have reflux, and you take milk that is unskimmed, meaning milk that still has the fatty component, it can actually worsen reflux. You may ask why. So the valve that separates the food pipe and the stomach has certain factors that can make it more loose or more tight. One of the things that make it loose is fatty foods or any form of fat. So if you eat chips, deep fried foods like mandazi, and milk, you know, milk has a very high fat content in it. It actually loosens the valve. So people who have reflux, some of them will tell you that if I take milk, especially milk that is non-skimmed, milk that you will not remove the fat, it worsens there. So it's just a small point to remember.
Okay. And so what tightens the valve?
Naturally, it's supposed to be tight. You shouldn't be able to take anything, any foods that tighten it, because naturally it's designed. That valve is designed, it always stays tight until it senses food coming. The only time it opens, it's when it senses food descending. So the moment it feels, it opens and closes immediately. So I'm not aware of any foods that you'll technically take once it has become loose to tighten. I think once it becomes tight, it becomes loose, we just go the way of trying to control or trying to sort it out, either surgically or through medicine.
Okay. And what kinds of medicine would help?
One, we use the normal antacids, the omeprazoles, but in addition, we add a second drug. There's a class of drugs called the promotility agents. Like you've heard of a drug called Placil. It's used mainly for people who are vomiting, or domperidone. These are drugs that tend to tighten the valve and also encourage the food to, instead of coming back up, to go down. There's another class of drugs called the etopride. These are also medicines that you can take to tighten the valve more, so that if a person who has reflux, it encourages the food to go down and the valve to stay tight.
All right. And the last one I've seen, it's about turmeric. Yes, the turmeric heals ulcers as well. Does that even have a relation, really?
I'll not comment. I've heard about it, but I don't think the science agrees with that.
Okay. So mambo ya turmeric surely tutumieni tu kama spices. All right?
And remember, we've said spices affect the wall of the stomach.
All right. So I'm seeing someone is asking that, are there certain medications that increase someone having ulcers? I think they're asking about developing ulcers. Are there certain medications that
we've already said NSAIDs. The other group is steroids themselves. You know, the steroids you take for allergies, the prednisolone, any dexamethasone, any of those. In fact, most of the time when you're given prednisolone or dexamethasone, automatically, even if you don't ulcer, we always prescribe omeprazole, because we know with time you'll get ulcers. This goes for especially people who have rheumatoid arthritis or some form of disease that requires steroids for long, yeah, you must always have a cover.
Okay.
Because definitely if you use steroids for long, they'll cause ulcers.
Okay. And can ulcers be, or the peptic ulcers rather, be completely cured?
Yes. If they're caused by H. pylori and you take, so there's something called a kit you had mentioned.
Yeah.
So this kit is composed of 3 medicines. There are many formulations in the market. The most basic will have an omeprazole or a drug of its kind.
Yeah.
And they'll have amoxil, the normal amoxil, which, you know, there's another drug called clarithromycin. Those are the old, now we've had to improve them. Okay. Yeah, because remember after we had corona, there was a lot of use of clarithromycin. So I think a lot of ulcers are now becoming resistant to the initial kit. So we're now moving to what is called the second line, which has something called levofloxacin. Even now we have third line. So if you take these medicines for 2 weeks, and then after the 2 weeks of the kit, you continue with another 2 to 4 weeks of the omeprazole or esomeprazole. Usually we advise after you complete the medicine, you have a test, a stool test. Okay. And if it turns out negative, you're actually confirmed cured. The only reason why they tend to recur is the same patient has other issues in their life that contribute. So you'll find that either they do not prepare their food well, so they go back to the same environment, or the people who generally have stress, or they have other risk factors, or they go back to their families where they eat acidic foods. So that's why you'll see it tends to have this recurrence picture. But if it's naturally eradicated, then it shouldn't come back. Lastly, we're in Africa. So you'll go behind the kiosk, you eat your smocha. Again, you reinfect yourself with H. pylori. So then the whole process starts again.
Okay, so you have to be very careful with how you prepare your meals, especially if you're struggling with H. pylori. Now, what are some of the meals that you'd encourage someone who's probably treating H. pylori to eat? Maybe
it's easier to say what to avoid. Because saying what to eat, there are so many possibilities. The easy way is just to say what should be avoided. I may not remember all, but in an African context, there are things which just have to go. Top on the list is spices. Any form of spices, anything that you have to add to make. Now, painfully, things like tomatoes and onions, they also contribute. But I would say, so that, you know, sometimes my ulcer patients come and tell me, if you tell me now to stop eating all this, now what is life without all these nice things? So for tomatoes and onions, I just say reduce the amount. If you're using 4 tomatoes, go to maybe 1. If you're using a whole bulb of an onion, maybe use a quarter. At least if you reduce, that's okay. Spices, I've said all of them go, especially pepper. The roycos can be used, but in very small amounts. The beef cubes can be used in small amounts. Coffee, especially black coffee, is just bad. It's bad, especially people who take the very conk espresso kind of coffee. That one goes. Skooma, so you can switch from skooma to less acid stimulating mbogas like kunde. So skooma and very bitter vegetables like managu. There's very bitter managu that stimulate. There's beans that one everyone knows. Though my patients tell me that there's a way they let the beans stand at night, then it reduces. I don't know. But beans also is an issue.
I've heard about the yellow beans.
Yes, I when they come and tell me, I usually ask them, so when you change, do you feel the symptoms? And tell me there are no symptoms, I say, okay, fine. Do your thing. Because again, you don't want to be too strict on people. Because if you tell them too many no's, then they ask you, okay, so what do I take? Because everything is no. In fact, I'm not even finished my list. I'm at the beans. Then there are behavioral things about eating, that worsens ulcers. For example, there are people who eat breakfast and then they don't eat a meal the whole day. This kind of behavior worsens ulcers. Why? Remember we said acid likes a situation where there's nothing coating the stomach. So you can imagine a stomach going empty for a long period of time. It means the acid is just, the wall of the stomach is exposed. So these are the kind of people who need to eat small meals multiple times. Now for people with reflux, it changes a bit. People with reflux will have to avoid things like chocolate, fatty foods. Remember I said those foods that loosen the valve. So mainly chocolate and fatty foods. Also alcohol if it will be part of the foods. Then we'll tell them when they eat, they stay upright for 2 hours before they sleep. Why? Because we want the food that is in the stomach to leave the stomach and go into the intestine so that when they sleep, it doesn't reflux. Also, we tell them to eat small meals multiple times. So instead of eating the 3 major meals, they eat like 6 meals in small amounts. So that encourages the food to go. So you can see there's a lot of, and in fact my list is still not exhaustive. I'm sure because I'm just getting it out of my head, there are a few other foods that might be responsible.
You'll add it on the list. Okay. Now let's get the Vox Pops so that we'll hear what people think. We had asked people about what they think, especially on what causes ulcers and what causes heartburn, because that's something that really affects people. So maybe we'll be getting direction on the theme a bit later. But for now, I see someone is asking, are there traditional remedies that might help with the peptic ulcers?
I don't know any of. I don't know. I think because we have medicines that are very effective and very available for ulcers, it's just safer to stick mainstream. The worry I have with traditional medicines is that they've not been tested. Yeah, you may go and try something which actually makes your ulcers worse. You know, but since we already have medicines that are available, they are not expensive. I'd always encourage you to just stick mainstream. Because other things are just experimental and you can't really vouch for that. And as a doctor, I can't stand here and vouch for something that has not been proven scientifically.
True. All right. Anasema, hello Rachel and Doc, hello. Anasema, how about gastritis? I have been having chest pains, especially when I take wheat product. It has been bad because I have these allergy reactions, itchiness, and also dizziness. I'm concerned about it. Every time I go to the hospital, I'm given antacids. I've also been on H. pylori kit meds, but still, it didn't go.
Yeah, that person is describing is a mixture of so many things. Could be some form of food allergy, some form of wheat intolerance. It could even some form of IBS, irritable bowel syndrome. So in a patient like this who has been treated several times, I always encourage they just go to a proper gastroenterologist or a gastrosurgeon who can go through. In fact, a lot of these patients, they come to me, they have been treated so many times. So I usually just tell them, just stop with everything. We just start from scratch.
Yeah.
Some are so complex that even myself, I can't even diagnose them. I have to send them to a more experienced experts. Because like this one, you see, she's talking about allergies. She's talking about wheat. She's talking about dizziness. You see, there's so many. And before I forget, now that dizziness has come up, one of the things we should not forget is the things I like calling red flags, red flag symptoms. If you've ever been treated for ulcers for a long time, and then you develop this group of symptoms. One, you start vomiting blood. At any point, you're vomiting blood. Second, you have difficulty in swallowing. 3, you start losing weight. 4, you start feeling dizzy and fainty, like you want to faint, or you are admitted in hospital because of anemia, meaning blood is low. Or one day you touch your stomach up here and you feel there's something. These are things which you should run to the hospital. This means that if you had ulcers, now they've moved to something that is not normal. You know, ulcers start as simple ulcers, but they can complicate to something very dangerous. Ulcers can do 4 things. One, they can bleed. An ulcer can just, you remember it said ulcer is a wound. So the wound can just burrow so deep it causes bleeding. 2, it can cause what is called obstruction, meaning you've had ulcers for so long that now they start impeding the flow of food. So you start vomiting a lot. Then 3, and this may come as a surprise. If you have ulcers for a long time, they actually predispose you to cancer. Yes.
Oh, wow.
Yes. So ulcers are not a joke. You don't just get, right now, a lot of our patients, they come to us and once they tell us they've had ulcers they've been treated for ulcers for maybe 2 or 3 times, we tell them, no, stop everything, just do an endoscopy. Because what you might be thinking is ulcer might actually be something different. And what we fear the most right now is cancer. So that should be patients who come to the doctors and they are found to have cancer, they'll always have this history that dates back to a long time where they've gone to hospital, they've been given omeprazole, and surprisingly, even when you have cancer and someone gives you omeprazole, your symptoms actually go away. You actually feel better because the growth that is growing, if it was forming an ulcer on top of it, it gets coated by the medicine. Because these medicines are so strong that they suppress acid nicely and the symptoms go away. And now this becomes a problem because if this cancer would have been caught early, the first time the patient came, you would have treated it easily. But now because you gave antacids, you gave the omeprazoles, they got better. Then they went home. Then after 3 months, they came to maybe a different doctor who did the same thing. So again, you lose 6 months. By the time you now realize, no, this is a problem, the tumor is advanced, you see. So treatment twice, that comes back, hospital and an endoscopy.
Oh,
Yeah.
okay. So you have to be very careful with this ulcer thing because people take it lightly.
Yes. Actually, it's so common. People don't think about the worst it can be.
Yeah.
So it's good to inform people that this thing can actually take a very bad turn.
Good cancer. Okay. So we have someone saying, good morning. I was diagnosed when I was pregnant that I have H. pylori and I wasn't treated by then. But 3 months ago, I went for the SOC H. pylori kit. Okay. Relsa and SOC 40G, I think, 40 grams. But there's no change. It's H. pylori and ulcer. I think you've answered that. But I said, how can I know which ulcer it is? And can it be treated completely? The other thing, and I said, when I go for a long haul, it's very irritating and very uncomfortable. And then nowadays, ako nauseated. Anasikia kutapika, kutoka kwa throat kuteremka, it's irritating. And every time I try, I just say, I try anything. So the other thing is that, is there an effect of using omeprazole for a very long time since I have been using it? So many questions in one, but I know that you've got an answer.
I think some of them we've covered. Some of them we've covered. Simple thing, she needs to see a gastrosurgeon to do an endoscopy. I think she needs. Then 2, we need to evaluate her for these other symptoms. You see, like the long cold symptoms, they're typically not related to ulcers. Could be having a different problem. So those ones need to be addressed. The issue about omeprazole long treatment, the reason why I face this question a lot is because one of the ways we treat reflux is long-term omeprazole.
Okay.
Yeah? Now, we've discovered that these omeprazoles are not as innocent as we thought they were. Yeah, if you use omeprazoles 6 months, 1 year down the line, you have 10 effects. I have a chart in my office that I always display to patients.
Okay.
Remember, there's a reason why God created you with acid. The acid is not there for fun. It does some work. So if you suppress it, there's some function you're affecting. The acid is used to digest protein, which releases zinc, iron, calcium into your body. You're able to absorb those minerals because you have acid. So if you shut off acid, you are not able to absorb iron, you're not able to absorb calcium, you're not able to absorb zinc. So you start having this deficiency. So magnesium, zinc, calcium, and iron all go down. Remember, calcium is used for bones, magnesium is for bones, iron is for making red blood cells. So there's that, isn't it?
Okay.
Now, remember, again, the acid that is in your stomach, I remember I told you that it shields the rest of the intestines from getting infection. Because when the bacteria come and they reach the stomach, they get killed in the stomach because of the acidity. Now, because you suppress the acid, these bacteria start passing. They go distally. They go into the intestine. So you start getting infectious diarrhea and such things. Yeah, simply because you're using the medicines for a long time.
Okay.
I've talked about the deficiencies. Also, people who use antacids for long, they start getting infections in their lungs. Because the acid that was supposed to, some bacteria actually you reflux them from the stomach into the lungs. Yeah? So because you suppress the acid, now you start getting recurrent pneumonias. Again,
so actually pneumonia would be caused by
not directly, it's specifically for people who have a lot of reflux. Yeah, because now you are suppressing the normal mechanism that clears off this bacteria. Yeah, so now you are letting them grow too much, and now they affect the lungs. Remember also, these are not free drugs; they are costly. So in a long time, you're using the same medicines for. So always it's good if the condition can be treated and cured, and then you stop the medicines for long. For a condition like reflux, now that's a challenge because for as long as you have the loose valve, you'll always reflux acid. So we end up using them for a long time. Luckily, there's now a surgery that we can do to stop the reflux. So for a patient who has had treatment for, say, 6 months to 1 year, and they still have the reflux symptoms, we usually offer them surgery. We tell them, look, if you use these medicines for long, you're going to have this and this and this conditions. So why not just do a surgery where we tighten the valve, and it's cured. And it's a very straightforward, minimal invasive surgery, and it solves the problem.
Many people wakisikia about surgery, they'd be like, let me just use the antacids, please.
and that explains the reason why they changed the surgery from the normal traditional cutting one. Long time ago, we would cut. This would keep the patients in hospital for long. But now we have a minimal access surgery. I just go to theater, and they have 2 very tiny incisions on the side of your stomach, and we fix the valve.
Okay.
And you actually go home the following day.
Oh, really?
Yeah. So now we're having to
easier.
prescribe it to many more people.
Yeah.
Because it's much easier. Yeah. Okay. Much quicker. The patient goes back to their work within a week. Yeah.
And then it's full recovery.
Full recovery.
Yeah. So Nasema, my husband was diagnosed with H. pylori. He doesn't like eating anything. He's ever full. Many of the things you say, I don't use while cooking. I'm stressed. What do I do?
Maybe the best way is just to separate the food. Yeah. For the person who is sick, they get their own share of meals because this is going to be a lifelong thing. Again, I would just want to know if the patient has been assessed fully. Okay. Yeah. Because what they think might be acid and ulcers may not be. Oh, there's another thing I wanted to say. These symptoms of ulcers mimic many other diseases.
Okay.
Just because you have this cluster of symptoms, you say it doesn't mean that it's ulcers. It could be other things.
Yeah.
Commonest thing that we confuse is gallstones. You know, you can actually have stones in your gallbladder.
Right.
They present almost exactly the same like ulcers. Okay. So you can imagine if you had stones and the stones were cured, then you never even have had this. There's a disease called pancreatitis. Again, same condition. There's a disease called IBS. Yeah. Same presentation. So sometimes these patients, when they've had this kind of treatment with all these foods they have changed and nothing's getting better, it's always good to see an expert who will dissect the symptoms and say, no, what you thought was ulcer is actually not ulcer. Yeah. But of course, the starting point is an endoscopy. Okay. It solves a lot of our problems.
Okay. And it's good that you said now it's not taking, you'll not take long in hospital. Again, I've loved the fact that it's full recovery. So you won't have
for the surgery.
For surgery. Iko sawa. Now, we'll be getting into the healthy living so that we get to see the segments. Of course, we have said before that today we're talking about peptic ulcers. So we'll get this very, very short segment to me letewa the one and only Sylvia Wanja. And then immediately after that, we'll be coming back to wind up because as I had said while we were starting, is that today we are also having another discussion later after we finish these. And today we are also talking about kids at home. How are you able to make sure that wanatumika vizuri wakiwa nyumbani? So that will reduce these cases that tunasikia za kids are using drugs sana. And of course, as you've heard, drugs will also cause peptic ulcers. So it's very important. Sawa sawa. But for now, let's get this segment ambayo tumeandaliwa na the one and only Sylvia Wanja, that is healthy living.
Peptic ulcer. Managing a peptic ulcer through diet can help relieve symptoms, promoting healing and prevent recurrence. Peptic ulcer, which are open sores that develop in the lining of the stomach or the upper part of the small intestine, are often caused by Helicobacter pylori infection or long-term use of NSAIDs. Here's a dietary management guide for peptic ulcers. Number 1, eat small, frequent meals. Eating smaller meals more often can help prevent the stomach from becoming too full, reducing acid production and easing comfort. Try to eat 5 to 6 small meals throughout the day, spacing them evenly to maintain a steady digestion pace. Number 2, incorporate foods that may aid healing. High fiber foods, that is, whole grains, fruits and vegetables are rich in fiber, which may lower the risk of developing ulcers and aid healing. Aim for fiber-rich options like oats, apples, carrots, and legumes. Flavonoid-rich foods. Plants like apples, berries, and tea contain flavonoids, which may inhibit the growth of H. pylori bacteria. Probiotics. Probiotics. Foods with probiotics such as yogurt and kefir can help restore the balance of gut bacteria, potentially assisting in healing and preventing H. pylori infection. Number 3, stay hydrated with non-irritating beverages. Drinking enough water throughout the day helps digestion and keeps the stomach lining hydrated. Herbal teas like chamomile or ginger can have soothing effects on the stomach and may reduce inflammation. Number 4, lifestyle tips for ulcer management. Eat mindfully and slowly. Eating slowly and chewing food can reduce stress on the digestive system. Manage stress. Stress can worsen ulcer symptoms, so consider stress-relieving activities such as deep breathing, exercises, yoga, or meditation. Number 5, include foods rich in antioxidants and vitamins. Foods rich in vitamin A and C like carrots, sweet potatoes, and bell peppers support tissue repair. Zinc-rich foods like pumpkin seeds, seafood, and beans are essential for healing.
In conclusion, following a well-balanced, low-acid diet with an emphasis on whole foods, gentle protein sources and fiber-rich options can help manage peptic ulcers. Avoid irritants, adopt stress management techniques, and maintain a mindful eating routine further supports healing and helps prevent recurrence.
So we are back with Dr. Winston Makanga, and we are here to now wind up. I see you have so many questions, but of course we'll be giving a number because time is really not together with us. Do you have a number that people can call?
Oh, yeah.
Yeah.
Yeah. So we can be reached at my secretary, 0791, that is 0791 670 644.
All right.
Yeah.
Okay, so that's the number. I know that it will be on your screens. Yes, perfect. That's it. So that's the number 0791 670 644. Yes, so that's the number. Please call, and then you'll be able to get the answers because I see you have so many questions. So what would be your parting shots?
Yeah, I think it's summarized as simple as this. What looks like ulcer may not be ulcer.
Yeah.
That's one. If you treat ulcers more than twice, see an expert. Let them do an endoscopy on you to figure out what is the problem.
Right.
Yeah, let's not treat ulcer indefinitely because of the risks we've discussed.
Yeah, for sure.
Yeah.
Okay, so that has been it for today's discussion. Thank you so much, Doc, for coming. This was a very important topic for us to talk about, and especially for the people who have been struggling with ulcers and reflux for a very long time. As you said, it can be really dangerous, such that it would even probably be cancer. So kama umekuwa ukitreat recurrently, you need to go get checked. All right, so that has been it. Thank you so much for spending time with us. We do value your time highly, but just remember, hatujamaliza bado. We have the part where we get to know what you have taken from today's discussion. So be coming back to check out the points that you've gotten, our take homes today. But for now, we will be getting the health tips by the one and only Perpetual Nyambura. As we come back, tutakuwa tunakuja sasa kuangalia the points as we go to our other discussion. So we have quite a long way to go. We said we'll be here up to 10 in the AM, so do not miss out. It's a really important segment that we are coming back for. But Daktari, thank you so much for coming. We do appreciate it. All right, so let's get the health tips.
Mtazamaji wangu, katika makala ya Afya Tips tutakuwa tukiangazia umuhimu wa mdalasini ama cinnamon kiafya. Mdalasini huongezwa katika vyakula kwa sababu huongeza ladha kwa chakula. Mdalasini huwa na virutubisho vingi na huwa na madini kama vile potassium, manganese, calcium, magnesium, zinc na chuma. Virutubisho hivi husaidia kupunguza shinikizo la damu na viwango vya sukari kwenye damu. Pia maji ya mdalasini pamoja na asali ni kinywaji bora kwa wanaotaka kupunguza uzani, kwani yanasaidia kuondoa sumu mwilini. Pia maji ya mdalasini yana antioxidants kama phenols ambazo husaidia kuimarisha mfumo wa kinga mwili. Mdalasini pia huboresha namna ubongo unavyofanya kazi. Maji ya mdalasini huboresha kumbukumbu na kukuza utendaji wa ubongo. Pia hupunguza maumivu ya meno. Mara nyingi tunasumbuliwa na maumivu ya meno ambayo hayavumiliki. Mdalasini ni kiungo chenye nguvu na huwa na uwezo wa kuponya jino linalouma. Mwisho, huboresha ngozi. Maji ya mdalasini husaidia katika kuboresha ngozi. Na pia ni chanzo bora cha nyuzi ambazo husaidia kuondoa sumu kutoka kwa mwili. Hii inazuia sumu zenye mazoea kutoka na kuziba ngozi. Ni hayo tu kwa sasa, mtazamaji wangu. Tupatane Jumatano ijayo katika makala ya Afya Tips. Jina langu ni Perpetual Nyambura.
We are here for the pointers because we need to see what is our take home from the discussion that you've had, because this is a discussion that really affects so many people. So we need to know what is our take home. Ni nini tunafanya from today onwards, okay? We say this is a very important segment because every Wednesday we talk about everything health. We say it, ata kama Mungu amekubariki sana, you have the money, you have a good job, you have everything, but your health is at stake. So many things you'll not be able to do. So you need to know what exactly are you supposed to do to have a good health, okay? So let's get into the pointers. Of course, my main one, before we get to this, my main one would be that it is very important for us to avoid taking a lot of spices, because many of us, and I know most of my friends, please feel attacked, yeah. Most of my friends, mnajua pilipili is usually the go-to each and every day. Kwa chakula zote, wengine wanaweka mpaka kwa chai surely. Please, let's reduce. And by reducing, I mean really reduce on lots of spices. So let's get to see what we are getting today on the pointers. Maybe we can have them on the screen. Asante sana. Is that the peptic ulcers, they are open sores that develop on the inner lining of the stomach or the duodenum. Okay, and the second one is that the most common causes of ulcers are H. pylori. Na H. pylori si ugonjwa, because most of us tunasemanga that H. pylori ni ugonjwa, blah blah blah, all that. H. pylori is a bacteria. Okay, so 1, H. pylori, and 2, increased use of antibiotics. 3 is that some of the symptoms may include abdominal pain, and that is some of the symptoms. Number 4 is that it is curable, and individuals should seek medical attention as soon as the symptoms are exhibited. All right, so that has been it for this particular segment. Thank you so much for tuning in. Now we'll be going for a very, very short break. As we come back, we will be coming back to talk about maximizing the potential of children wakiwa nyumbani, because now we are having kids at home. Let's get it. Yes, now we are having kids at home, and we must know what exactly we are supposed to do now that you're having them around. Wasikwe wanakaa tu. Okay, so as we come back, we'll be coming back to talk about maximizing children's potential during the holidays, and we will be talking about this with Pasi Kihumba. It's not the first time that we're having her here. So we're going to be having an amazing conversation, so do not miss out. Sawa sawa, for now, let's get some music, and then we'll be coming back.